My name is Shelley Laginus. I'm a nurse practitioner at Beaumont Health System in Royal Oak. I'm here today with my patient, Cliff Mays, who is here to tell us his story about his underactive bladder. Mr. Mays, how has underactive bladder impacted your life?
Well, from the time I heard about it, it's in some ways it's taken over my life, but I'm glad I found out about it because the results otherwise could have been disastrous. But what it means is that 3 times a day, I'm going to be using the catheter, and those always have to be with me, whether I go on a trip, wherever I am. If I go to a baseball game, a football game, I always got a time thing so that's taken care of. Plus the fact that you have occasional bleeding. That all said, I'm thankful we have the catheters because that's been an asset that's probably protected me from more serious consequences.
Let's talk a little more about the bleeding. You've called me several times with issues and problems. How does that happen usually, and what's going on when you start having some of the bleeding issues?
It probably happens because I'm impatient and I'm hurrying. But I try to be very careful, but it just seems once in a while, I think that's very sensitive tissue in there, and it doesn't take a heck of a lot to where you scrape it and then blood comes out. Usually it clears up within a couple times.
But you're scraping it with the catheter?
Yeah, the catheter itself is scraping it. I don't think the catheters are unusually rough, it just happens.
And then you also talked a little bit about having to do it every 3 hours. So how does that impact your life when you're traveling and doing things?
Yeah, I wouldn't say every 3 hours, but it's 3 times a day. And you have to do it at regular intervals because you don't want this to build up in your system. And so it does impact travel time greatly. You have to adjust everything you do around that rather than setting your schedule and letting the catheterization fit into that.
Having said that, you clearly deal with this very well. What were the coping strategies you used to help you learn to deal with this?
The coping strategies were to give in and let it rip, but I don't know that I had any great coping strategies. I just decided this is something I wanted to do. It's something I need to do to keep healthy, and so I do it.
Mr. Mays, you've been with myself and Dr. Diokno for a number of years. How did you first begin the relationship with Dr. Diokno?
Well, it's fortunate. I went to a doctor who actually was part of another hospital, Dr. Ed Pierce. And Ed Pierce had known Dr. Diokno through his involvement at University of Michigan. And so one day I got a call from Ed saying, we just did a PSA test on you, and the results seem to be that you're a little bit high. I said, what do I do from here? He said, I'll tell you what, there's a guy over at Beaumont Hospital that I knew at U of M. He says, Dr. Diokno, he says, he's the best. And he says, go see him. And so I did. And it all started from there. And then the way I got down to the urinary retention was the fact that in these periodic tests that he ran, Dr. Diokno found out that I was retaining an extraordinary amount of urine, and hence the start of the catheter test.
And at one point in time, you also were told that you weren't or at one point in time, you quit emptying completely, didn't you?
Well, I don't know if I quit emptying completely, but I quit emptying to the point there was about 1,000 cc's in there, so it was enormous.
Recently, we approached you about a new study. Can you talk about that a little bit with us?
Yeah. When I first heard about the study, it was actually several years ago, and I mentioned to you guys that I'd like to be part of it, and I never heard from it again. And so anyway, then lately you came back, you and Dr. Diokno, and said, how'd you like to be part of it? And I asked a few questions about it, and I said, man, I'm all for it. And I jumped in because I think it's just a wonderful opportunity.
And this study involved stem cell.
Yeah.
Can you tell us what you understood the study to be?
All I understood about it, because I'm a layman, not a doctor, is that they were taking some muscle tissue out of my right leg and take that and implant it into my bladder after allowing it to grow in a lab, and that the hoped-for result, the expected result, was that that would grow the muscle tissue in the bladder and hence improve my ability to urinate on a regular basis, on a normal basis.
Now, this has been a short time since you've had that, so we're not expecting dramatic results, but have you noticed any differences at all yet?
Yeah, you know, I don't sit there and log the results, but on the other hand, I've observed that I feel the urge to void, I think a little bit earlier in the game, if you will. And it seems to me that I'm having a little bit less when I do catheter. I save it into a container, and I'm getting a little bit less of that. So my sense is there's some improvement, and obviously I'm hoping for even more.
Well, I thank you very much for your time today. Is there anything else you think we should discuss today about your underactive bladder?
Not at all,
Okay, thank you.
except my pay.
My name is Shelley Laginus. I'm a nurse practitioner. I work at Beaumont Hospital in Royal Oak. I've been a nurse practitioner working with urology for over 13 years. The worst aspect of underactive bladder with my patients is probably not really being diagnosed correctly or accurately. Frequently, we'll have patients that come from the ER, from post-surgery, with catheters in that probably have had underactive bladder for several years and now have a catheter that we have to take out because they've been told they have a large residual. So that's probably one of the biggest things that I see is the patients not being recognized early enough and not being treated as best we can or left alone if they're asymptomatic. The most impactful thing that we can do as nurses to improve quality of life is really care for our patients. We have to understand that these patients are scared, they're nervous. Underactive bladder impacts their lives in so many negative ways, especially those that have to catheterize. So we need to be supportive of them. We need to make them understand that this is not going to ruin their life, that they can handle this, and that we can work together to make sure that they can do this. I had one patient who comes to mind. He was a wonderful man. He told me he would never be able to learn how to catheterize himself because that was just more than he ever could. By the time we were done, and after just getting him to relax, he developed a little kit that he shared with the other patients that he took with him when he had to go out of his house because now he could catheterize in public without being embarrassed. And that's a huge step for the men as well as the women because it's very difficult to cath yourself, especially in public.